On Wednesday, June 25th, John Wilson Odhiambo, a photojournalist, was covering protests in Nairobi. When a green high-pressure water cannon police truck sped towards protesters on Kenyatta Avenue, he saw the perfect opportunity for an action photo. He quickly took cover behind a postal pillar, one knee on the ground just in time as the water cannon targeted a protester.
Boom, I just felt a pressure on my back. And by that time, when you're surprised with something, you're like, why are you pushing me? So I'm being pushed, I'm thinking and I'm going, And then that's when I hit my head, started bleeding. And then I also realized that I had already knocked my arm in one of the pillars by the roadside. Yeah. This was a very big pressure because I've never felt it.
The high-pressure water cannon sent him flying, knocked him down on a concrete pillar where he sustained injuries on his face, ribs and arm. Having covered multiple demonstrations in the past, he did not think that he would be hurt during the demonstration. It was the first time Odhiambo was hit by the high-pressure water cannon. Dr. Wala Amakove, a medical doctor, human rights defender, and founder of Beyond the Stethoscope, led a team of 50 medics in the temporary clinic to give first response care to casualties, and that is where Odhiambo received first aid.
So in the last 2 weeks or so, we've partnered with Kenya Medical Association, which I'm a member of, and other organizations like Independent Medical Legal Unit, Defenders Coalition, Amnesty International, Medics for Kenya, basically to bring together volunteer medics, set up a medical facility within the Nairobi CBD to offer care, first response care for anyone who's injured, both whether it's a protester, bystander, the police, we don't discriminate here.
According to Dr. Wala, the initiative was started last year by Medics for Kenya, a group of young medics, before more medics rallied in to support them.
The essence of it, to offer that first aid care, do what we can, and then now those who need to be referred are referred to the various hospitals within the city. Well, it's very different in terms of the facilities being, stationary. Last year we had 2 sites in Nairobi, and I think a couple more in Kisumu and Mombasa. And it helps that people know there's a physical facility, because what happens is all the facilities within the CBD generally close down for their own safety also. So it helps to manage, and we bring in specialists up to the highest level. Last time we had orthopedic surgeons, we had cardiothoracic surgeons. So there are different levels from emergency medical technician all the way to specialists in that space. So they're able to advise quickly, stabilize. Our mission is to stabilize and prevent further injury or death or loss of life. And that has really helped. And then now we work with the ambulances for evacuation.
Despite getting the green light from the authorities after informing them of their intention to set up a clinic in the Central Business District, Dr. Wala's team was still tear-gassed within the clinic.
They still attacked the facility, but after that we also identified their leader, and we had a word with him and said, this is a safe zone for everyone. What was happening is that they also came, because we were in a small street, Kigali Road, and so the barricade, they sort of ambushed the protesters into that street, yeah. And so again, even just the fact that we are having crowds around the facility was also potentially a threat to us.
The clinic, however, managed to attend to many with injuries and referred hundreds of them to Kenyatta National Hospital and other hospitals around Nairobi.
On the 5th of June, we attended to over 500 casualties, which is like 3 times what we attended to last year. The numbers are many. Out of this, we did 89 referrals. And out of the 89 referrals, I think 8 were gunshot, live bullets wounds. And then most of the rest was maybe rubber bullet wounds. We had fractures. We had people being stabbed because I think there was a confrontation. We had people with bullet wounds even to their faces, their hands, limbs were blasted out. It was not nice. We had pregnant women. We had 3 unconscious pregnant women. We had 1 sexual violence, a lady who was sexually violated at 3 p.m. We had a number of people who just collapsed from the sheer shock of being in those situations. But for the most part, a lot were cuts and bruises and maybe just a bit of counseling, but resuscitation was generally to around, referrals were 89, which was a very high number of injuries. We are happy that there were quite a number of ambulances that were able to also quickly evacuate many of these especially to the National Referral Hospital, but then we also had a few to the county hospitals.
The high number of injuries in the protests, however, should not be the norm, especially since the Constitution provides for peaceful protests.
We've had protests that are peaceful, and it's within our constitutional right to hold protests once you've alerted the forces. So I think it's important that we reflect as a country that these things, it's not just a one-day event. There are lives that are impacted forever.
In addition to the use of force by the police through live bullets, rubber bullets, batons and whips, the crowd control equipment used in Kenya have been found to be harmful. Odhiambo believes that the crowd control equipment used on that day were different from the ones used in the past.
Tear gas is kind of orange and blue, and there's another black one. And then there's a tiny one that we are used to, the one that gives out smoke from both sides. So I'm used to those kind of tear gas. But then the tear gas that I saw this time was, I don't know how to describe it. It's a different color. And then it's hand grenade. You know, you have to close your ears, when it's exploding. Like unafunga masikio, you close your ears because you know how much of an effect it can cause to you. So that's what I was doing personally.
If exposed to tear gas during a protest, it is recommended that you get out of the cloud of tear gas and away from the general area as soon as you can by walking. If your eyes were exposed, flush with clean water without touching your eyes, nose, or mouth. In case of gunshot or injuries like cuts or blunt force trauma, call emergency services immediately and apply pressure to wounds to control bleeding while waiting for help. Anthony Langat for Willow Stories.